Angry protesters campaigned outside the Queen Elizabeth Hospital, and through their eyes, the services are dead. The Trust is 10th on the list of the most complained about health bodies in England. They received 95 complaints in 2010 to 11, up from 88 in 2009 to 10. Most complaints were about clinical care, treatment, or poor communication. The NHS cuts are of national concern. Services and staff numbers have been reduced throughout the whole country. Patient Action Group argue that South London Healthcare Trust cuts to Queen Mary's, Princess Royal and here at Queen Elizabeth Hospital has claimed lives. But has anyone else been affected? Donna Howe's father John was diagnosed with bladder cancer in 2008. Mr. Howe's treatment was delayed for 5 months and the cancer spread to his brain. He died in 2009.
They didn't perform a CT scan here, and that was the main complaint that came out from the Ombudsman and by the General Medical Council, that should have happened. And in my opinion, the reason why that they didn't perform the CT scan when they should have done was because of cost. I believe this hospital does a lot to hold back on costs, and I believe that's the reason why my father's treatment was delayed.
These are the faces of South London Healthcare Trust management, who the campaigners blame for ward closures, lack of basic equipment and escalation of appointment cancellations. Has the services improved?
But in the last 2 years, the improvements in the mortality rates have been very, very significant, and we've moved to actually having one of the lowest mortality rates in the country. So to claim that things that have happened here have cost lives, I think is disingenuous, and I think it unduly will worry patients when in fact the opposite is the case.
The cuts are affecting everybody in the hospital. The treatments poorer, appointments are being cancelled and rescheduled, not for a month's time but for 6 months' time. They need to stand up and listen that this hospital is failing, and the ultimate end to that is and will be more so that patients are going to die.
As the NHS reforms are underway, growing concerns of cuts to local hospitals from staff to patients continue. Yet the government insists the changes will be a positive for the future. Pamela Carlu, LCC News.